this equipment in hospitals. It is used actually very low voltage, lower than 100 watt, and the current is around 5 milliamp. It is actually when provide this treatment, the patient can feel it is painful, and you can find the muscle contraction. So this can induce the body response, like the muscle contraction, can feel it is painful. But when you use eLife and feeling, no, why? So there's no feeling, no body response. But why you believe they can treat disease? So this is different. The eLife is different from the traditional electrical stimulation. The traditional electrical stimulation is low voltage but relatively high current. It is used the current to treat disease, to induce the body response, like the muscle response, like the nerve conduction, and also so other response like the feeling, the sensory responses, and so on. So for making diagnosis, for providing treatment. And what is eLife? eLife is from, there are several parts of this machine. So this one is electrofield generator, and then you have insulator and also an M mat, the mat with charge, with negative charges, right? And you compare this table, the data, the voltage, the current, compare with the traditional electrical stimulation is quite different. So the voltage is very, very high. It's 20 to 90 times the traditional treatment. Usually we use below 100 volt. But this starts from 1,000 or 2,000, and can be as high as 9,000, right? Very high. But you look at the current, the unit, it is a milliamp. So the range is between 0.2 to 0.9, right? Compare with the traditional stimulation, so but you can feel pain, it's painful. You can observe the muscle contraction. It starts from 1 to 5 milliamp. So this is much lower than that one. This is why you cannot feel the stimulation, even there is electrical field. So what is eLife? Now we just summarize its function as actually it has multiple names as mentioned by Stephen, like the electricity field therapy, potential therapy, static electricity therapy, and I find it is very comprehensive description as a post-electrostatic field therapy. So with abbreviations is PESF, P for post, E for electrostatic, and E and S is for electrostatic, and F for field, as post-electrostatic field therapy. Yeah, and its function is through post, because it provides 50 hertz stimulation. 50 hertz means in a minute, 50 times stimulation. So 50 very short in current stimulation. And high voltage, because the voltage between 1,000 to 9,000, very high. And it is low current because it is as low as 0.002 to 0.2 milliamp to 0.9 milliamp. And what you can feel the electrical stimulation, the current starts from 1. So with the highest level, actually the sensitivity to electrical stimulation varies from people to people. If you are very, very sensitive, so it's the highest level as 9,000. So level 9, you can feel a bit tingling. But if you are not so sensitive, I think more than 90% not so sensitive, but you feel nothing, right? Yeah. So I think the name, I like this name, is post-electrostatic field therapy, because this is a comprehensive description of this method. So here I just show you several slides to show actually the physics of this method. So this is an electrostatic field. Actually, on your eye mat is with negative charge. It can be with positive or negative charge. But with this machine, actually, you're using the negative charge. And why you change the different levels? Because different level is related to this force. Okay, the here, the voltage, and the here, the force. And the here, the energy you can get. And if there is a hair force, so it can penetrate to deeper tissue, and also in our body, actually, the electro resistance of different tissue is quite different. So some tissue is quite with relatively low resistance, and some other tissue with high resistance. I'll show you later the tissue, the different electro resistance in different tissue. And the stimulator, actually, we have two types with this machine. One is a mat, right? Yes. And another one is a handheld, as what is the arm pen? Yeah, the arm pen. So one is pen, one is mat. The mat is a. So the physics for the flat, we can show with this. And what about pen? Actually, it is a ball charger. Right? Have you used the pen?
Yes.
Yeah. And you feel something with the pen? Tingling, right? When you touch the pen, you feel there's stimulation, right? Yeah. Yeah. Why there is difference between the mat? It's connected to the same machine. And with the pen, it's very low. Actually, you can use only very low level voltage, only 2,000. Cannot change, right? Can change? Can change to 9? No. Yeah. So, but with the pen, usually you can feel when you touch to your skin, the skin feel there is tingling, right? Yeah, it's painful. Why? You connect to the same machine and you use the lowest level, 2,000 only. But with the mat, you feel nothing. Yeah, this is because you look at this. It's actually through the ball, the area is very small. Then, if you have same charge volume, then the density higher in the ball, then at the ball surface rather than on the mat surface, right? Yeah. So the current actually is higher in pen rather than in the mat. So actually what you feel is the current, the level of the current. Actually with the pen, it's with a low voltage but a high current. And it provides only treatment to a localized disease, so only local tissue. So you feel this only when you touch to your finger, only your finger can feel it, but it will not over the wrist or travel to other area, right? It's very localized feeling.